Welcome back. In this session, we will discuss about another homeopathic remedy called Mercurius corrosivus. The common name of Mercurius corrosivus is corrosive sublimate. It was proved by Dr. Hahnemann. The representative formula of corrosive sublimate is HgCl2. So it is mercury is represented by the symbol Hg. So mercurius corrosivus, Cl2. So let's see the preparation. So it is proved by our master Hahnemann with the help of a physiochemical process. It is by mixing one part of the mercury with two parts of the chlorine. So how does the symbol HgCl2 come up? It is one part of the Hg and two molecules of the chlorine are taken and prepared, and hence it is mercuric chloride. The keynote which runs through the whole drug is the great tenesmus. We see that these patients have a great tenesmus either in the rectum or in the urinary bladder. The tenesmus can be present either in the rectum or urinary bladder, or most of the times the tenesmus is so severe and it is present in both the urinary bladder as well as the rectum. So this Mercor is slower and more sluggish. Sorry, Mercsol. There's some error. The Mercsol. Okay, this is Mercsol. So there is a comparison which is made between Mercsol and Mercor. Mercurius solubilis, which we will be dealing in the next video, and Mercurius corrosivus, which we are dealing here. You can see Mercurius corrosivus. Mercurius corrosivus is violent and active in its movement. Corrosivus, you can remember something like corrosive. It is very violent. So Mercurius corrosivus is very violent and active in its movement. It takes hold and runs its course with a greater activity. It takes hold and it is running its course with a greater activity, whereas Mercsol is slower and it is comparatively more sluggish. So this is the comparison. We're also comparing the tenesmus in the next slide. Here you remember that the Mercsol is slow. Okay, S for Mercsol, S for solubilis, S for slow. Mercsol is slow, whereas corrosive is very violent, very active in its movements. Mercurius corrosivus is to be prepared to any of the drugs mentioned for syphilitic symptoms. So we prefer this Mercurius corrosivus. We indicate or prefer the drug in cases of syphilitic symptoms when the ulceration is very destructive. You can see here the ulceration of the penis in cases of this syphilis, which has eaten away half of the penis, and we have this destructive ulcer in the throat and the palate. So we see this is preferred in the drugs which are mentioned for syphilitic symptoms when the ulceration is very destructive in nature. Syphilis is destructive, hence the ulcers here in Mercurius corrosivus are also very destructive. The deer is serpiginous. It has ragged edges. So the edges are very ragged, eating out and destroying in a few days nearly half of the penis. That's what I said you. The edges are going to be very ragged irregularly, and it is going to be torn out, and they are eating out and destroying in a few days. They'll be able to destroy half of the penis. Mercurius corrosivus is very much resembling to Mercurius solubilis or Mercurius in many of its pathogenesis. But therein we see the severity is varying in both the drugs. The excoriation and burning, rapid spreading of the ulcer, tenesmus, these are comparatively more in Mercor. It is more violent, right? I said you it is more violent and rapid in its actions. Within a few days it was able to eat half of the penis. So we see here we see it, the excoriation, burning, ulcer and tenesmus is more in Mercor. The ulcerations, the burning, excoriation and also the tenesmus is more in cases of Mercor. Moving further to the sphere of action, acting on the mucous membrane of the intestines, urinary bladder and the eyes, it will cause irritation and inflammation. So Mercor acts on the mucous membrane. Mucous membrane of what? Mucous membrane of the intestines. It acts on the mucous membrane of the intestines. It acts on the urinary bladder. We see it acts on the urinary bladder and also in the eyes. Mucous membrane of intestines, urinary bladder and eyes, and it causes irritation plus inflammation. Acting on the serous membrane and the connective tissues like in the peritoneum. So we see it acts on the serous membrane, that is serous membrane or such as the peritoneum as well. Acting on the rectum bladder, it produces tenesmus, and on the urinary bladder it can also result in suppression. So we see acting on the urinary bladder and the rectum. Acting on urinary bladder and rectum, what does it do in these two cases? It produces tenesmus. Okay, tenesmus. What is tenesmus, guys? Tenesmus is something when the patient has the desire to defecate, but it is ineffectual. He is not able to pass stools, but he still has a desire that he need to pass stools. He has a desire he need to pass the urine, but no urine is coming out. It is not effectual. It is ineffectual. It is not productive. It is the urine is not passing, the stool is not passing. Yet the patient has that urge and the desire to pass the stool as well as the urine. So the tenesmus of the rectum and the bladder, suppression of the urine is observed. So the great tenesmus and also the pain and that persists before, during and even after stool. So the desire to pass the stools will remain even before passing the stools. He has the desire. During passing the stool also he still feels that it is incompletely evacuated and he has to still pass the stools. And even after the stools he feels that tenesmus. Tenesmus is not relieved by stool in cases of MERCUR, whereas the stool is going to be scanty. The mucus is mixed with the stool. Okay, how is the stool? The quantity of the stool, it is scanty. It is very much scanty. It is mixed with mucus. Okay guys, clear? Tenesmus, it is persisting before, during, after stool, and also not relieved. It is not relieved by stool. The throat is intensely inflamed. You can see the throat and the palate, everything is intensely inflamed, swollen. There is burning with the swollen gums which bleed easily. Even the gums, are going to bleed easily. The ulcers, they will spread very rapidly, like we saw in the first slide. So the throat, what did we study in the throat symptoms? The throat is going to be swollen. There is burning, inflammation. The gums are also, so we see the gums are also going to be swollen. They will bleed very easily on touch. Ulcers will spread very rapidly. The desire for cayenne pepper, we see cayenne pepper here. The desire for cayenne pepper, ice, and also the ice chilled water, cold water. Ailments from syphilis, sun and summer weather. So we see the ailments from syphilis. We have just mentioned the stages here, where there will be sores or chancres in stage 1. In stage 2, the body rashes like roseola, all that will be present. In stage 3, it will affect the internal organs, especially the CNS and heart will be affected. All of this is not required the medicine part. So now we'll just focus that because the ailment is because of the syphilis and sun and summer weather. You can see the sun and also the summer weather. These are the ailments. Moving further to the mental symptoms of MERCUR. Mentally, these patients have anxiety, which is preventing the sleep. Weak intellect. He stares at the persons who talk to him. He has a weak intellect. The intellectual power is very low, very weak. So he just stares at the people who are talking to him. He does not understand what they are talking. He just stares at them. He does not understand them, what they are speaking. He's depressed, low-spirited person, ill-humored. He doesn't take the criticism easily. He doesn't take things positively, gets easily offended. He is ill-humored, during which nothing pleases him. Alternating with hilarity. So then it is also alternate. First he'll be very ill-humored, getting upset, angry, finding faults. Later what happens? It is alternating with a lot of hilarity. He's just laughing loudly, cracking jokes. So we see this is an alteration of the moods between the hilarity as well as the ill-humoredness. Stupor, stupidity, and unconsciousness is also seen. There is delirium. So you can see she's just anxious, she's not able to sleep, and they are low intellectual people. They just stare at the people. She's sitting there and staring at the people. She does not understand them. She's low spirited, depressed. You can see the picture here. She's so depressed, low spirited, and ill humored. Nothing is pleasing her. Sometimes it can also alternate with hilarity. Moving further to the particulars, so far we saw the guiding symptoms. Let us apply the guiding symptoms here, and then some additional points we will discuss. So, in the eyes of Mercur, eyes, we see there is ophthalmia neonatum. So, because of the syphilis, when the baby is passing through the genital tract, it comes in contact with the syphilitic, condition of the mother, and he develops this ophthalmia neonatum. There is burning, excoriating discharge from the eyes. You can see the picture and remember it. Mercur and ophthalmia neonatum. There is burning, excoriating discharge which is coming from the eyes, along with the soreness of the eyes. You can also see the soreness which is in the eyes, present in the eyes. Eyelids will be swollen. Obviously, you can see the eyelids to be swollen. Let us just write down here. There is burning. You can just see here, it is so corrosive. It is excoriating discharge. It has completely excoriated the lashes. It is excoriating discharge from the eyes. There is soreness of the eyes. The eyes are swollen. Clear, guys? There is excoriating, burning, excoriating discharge, soreness, swollen eyelids. Ulcers in the cornea. You can also see the ulcers in the cornea. The eyelids are closed, but if it is open, let's just draw here. There is also ulcers in the cornea, and deep ulcers are on the cornea. It is iris will be muddy in color, thick, and neither contracts nor dilates. The iris is going to be muddy in color, muddy color of the iris. The muddy color of the iris, it is neither going to contract nor it is going to dilate. Head, we saw the delirium and stupor and the mental symptoms. They have frontal pain, congestion of the head with the burning in the cheeks. They have this frontal pain, okay? They have frontal pain. Mercur, head symptoms, there is a delirium, stupor, frontal pain, burning in the cheeks. There is burning, frontal pain and burning in the cheeks, drawing pain in the periosteum of the skull. I have taken this to show you the periosteum of the skull. There is drawing pain present in the periosteum of the skull. Clear, guys? What did we see under the head symptoms? We saw the delirium and stupor. Okay, delirium, stupor, frontal pain, congestion of the head. Then we saw drawing pain in the periosteum of the skull. Cheeks will be burning. Mouth symptoms, we know the teeth, the gum is spongy, swollen, bleeds on touch. Tongue is also swollen, inflamed. Teeth are loose, pyorrhea, and talcum. Talcum, there is excessive salivation, production of excessive saliva. Then mercur is indicated. Salivation is profuse, salty and bitter taste in the mouth. They have the salty and bitter taste in the mouth. Guys, you can see the gums to be swollen and spongy. The tongue also is going to be swollen and inflamed. Gums are swollen and spongy. Tongue is swollen and inflamed. There is talcum and pyorrhea. Then we also have this salivation which is profuse and salt and bittery taste in the mouth. The teeth are very loose. Throat, uvula is swollen. Swallowing is very painful in these patients. You see the uvula to be swollen. Uvula is swollen. So swallowing is very difficult obviously to the patient. There is rapid spreading ulcers with a burning pain with a great swelling. We know the ulcers are rapidly rapidly spreading, and there is burning pain and swelling. All the glands of the throat are swollen. You can see the glands of the throat here, the tonsils, all of those glands are swollen, completely swollen, and it is worse from the external pressure. Okay. And the swallowing is difficult. So guys, what did we study in the throat symptoms? Uvula is swollen, throat glands are swollen, ulcers are spreading, burning pain, and there is swelling. Dysentery. I told you mercur is a very famous remedy in cases of dysentery, or especially of the violent cases. There is violent dysentery present in the patient. Mostly during the summer weather. We saw the ailments from summer weather and sun. Stool is going to be copious, bleeding, slimy. Since it is dysentery, obviously the stool is going to contain. So the stool contains blood, mucus. It is going to be slimy. It is copious, bleeding, slimy. It also contains a streaks of mucus. So the stool contains, so let us just see here. Okay, the stool contains what? The stool contains a copious, it is very copious. It is copious in the sense it is very profuse. It is profuse, large in quantity, bleeding, slimy. Dysentery, right? What is dysentery? When the diarrhea is mixed with blood. Okay, then it is dysentery. So we have slimy, contains streaks of mucous membrane. It is very offensive. With the frequent evacuations. The evacuations are frequent. Before stool, the patient has tenesmus. During stool, tenesmus. After stool, tenesmus. So this is very important. So you see, before stool, tenesmus. During stool, tenesmus. And we also have after stool. Okay. There's some error. Fine. Cancel it. Okay, let's continue. So after stool also we have the tenesmus. So this is the three things which are present. Before stool, the tenesmus, there is colic, which is cutting character. Cutting colic and urging to stool with tenesmus of bladder too. There is also tenesmus of bladder. Along with the tenesmus of the stool, there is also tenesmus of bladder and cutting colicky pain present. During stool, tenesmus of rectum may be accompanied with the tenesmus of bladder too. Just like in before stool, even during stool, the tenesmus of the rectum is also accompanied with tenesmus of bladder. After the stool, there is no relief. The tenesmus is still persisting for some time. There is burning in the rectum. You can see along with the tenesmus, there is a great burning in the rectum. It is aggravated at night and by motion. The tenesmus is aggravated and the dysentery is aggravated at night and by motion. Moving to the concomitants. Very important are the concomitants in cases of the dysentery. Mercur is a famous remedy for dysentery, especially a violent dysentery. What are the concomitants? Unquenchable thirst. The thirst is unquenchable. They have this salivated, swollen tongue. Abdomen is also swollen, hard and sensitive to pressure. You see, unquenchable thirst, the tongue is also swollen. Moving further down, we have abdomen. Abdomen will also be swollen. It is hard, sensitive to pressure. The pressure aggravated from pressure, right? So it is very sensitive to pressure, especially above the umbilicus. Scanty urine, which is passing drop by drop. Okay, the urine is so scanty, it passes drop by drop. It is hot, bloody urine with tenesmus of the bladder. So guys, you see here, there is tenesmus of the bladder and the urine is passing drop by drop. It is hot urine. Okay, the hot urine passing drop by drop. It is bloody urine. It is scanty with the tenesmus of the bladder. There is faintness, weakness and shuddering. Along with all of these, there is faintness, weakness and shuddering, cramps in the calf muscles. Yeah. Next, urine. There is tenesmus of the bladder with a burning in the urethra. We saw the character of urine. It is hot, burning, scanty, suppressed. It is voided drop by drop. There is great pain. It is bloody. Intense burning in the urethra. We see this intense burning in the urethra, tenesmus of the bladder. Along with all of these, there is a stabbing pain which is extending up the urethra into the bladder. The stabbing pain will be extending from the urethra up into the bladder. Concomitants, the perspiration is seen after urination. Albuminuria, that is loss of albumin in the urine in cases of early pregnancy. Phosphorus is indicated in albuminuria of the pregnancy, especially in the later stages at the full term. Okay, So, guys, what did we study on the urine symptoms? We know the character of urine: hot, bloody, and it is passing drop by drop. There is intense burning with the tenesmus of the rectum, tenesmus of the bladder, which is also alternating with the tenesmus of the rectum. Both together will be present. And we also have this stabbing pain, which is extending from the urethra. It is going straight up to the bladder. And the perspiration is seen after urinating, which is the accompaniment. And we have albuminuria in the pregnancy, especially the early pregnancy. In the late stages, we have phosphorus. Moving further to the gonorrhea. It is ailments from, we saw the gonorrhea, suppressed gonorrhea. So we see in the second stage of the gonorrhea, when the greenish discharge is beginning to flow, with the burning in tenesmus is continuing, Mercur is of a great remedy. So we see there is burning, tenesmus continuing both in the rectum and the urinary bladder. It is also associated with gonorrhea. The greenish discharge is beginning to flow, whereas the tenesmus and burning is continuing. It is aggravated at night, since it is, all of the syphilitic complaints. Aggravation of syphilis is probably at night. So the miasm is syphilis here. It is aggravating at night. Concomitant, the penis, testes are swollen. Chancres are assuming a phagedenic appearance. So we see this chancre assuming a violent appearance, and it is going to spread very rapidly and eat off half of the penis in a no time. So we move to the modalities, the general modalities. It is aggravated in the afternoon, at night, and summer, and amelioration is by rest. So we see modalities: the summer, sun, at night, afternoon, and amelioration by rest. With this, we come to an end of our lecture on Mercurius corrosivus. I hope everything is clear. If you have any doubts, put them down in the comment section. And if you like the video, hit the like button and subscribe.